Ms. Bennett, thank you so much for being here and speaking today. I have a question. It's sort of, I think, a follow-up or related to what Representative Dauphiné brought up about feeling confident that the practices aren't deceptive, and so you feel like there's changes financially that are of an impact that would happen to you if this legislation was passed. And I think that I can summarize what you're saying is that you're worried about guilt by association. So, like, if something like this happens, you're worried that the deceptive practices would be associated with you and your organizations, that you feel confident in defending their actions and their behaviors. So, you mentioned affiliation with your previous affiliation with ABC Women's Center. And earlier today, I'm not sure if you heard, but we talked about one of their claims on their website. Or not claims, I apologize. I don't want to misstate what it says, but one of their directions on their website to a pregnancy reversal or abortion reversal option, which is not medically sound advice and not clinically appropriate and risky guidance to be giving to folks. Do you feel like that's deceptive and should be changed?
Well, honestly, again, I think it goes back to partly the abortion wars, because I have read that there are states that actually require that information to be given to them. I think Nebraska is one. I believe maybe Idaho. And what I'm saying right now, I'm not an expert on, but I can definitely give the information. But I have read that there are some states that do require some information on progesterone to be given after the RU486 pill. So I've traveled all across the country, and part of that is just telling my testimony about my mom scheduling to abort me and then walking out. And so what I've noticed is that depending on the state you're in, it's completely different. Like, we wouldn't be having this argument in a pro-life state, so to speak. So like in Alabama or Georgia, they would never dare to harass pregnancy center leaders in this way, and even to go over everything on their website and to accuse them of being false. That wouldn't be happening because they really honor and revere the work of pregnancy center leaders. But because we are in a pro-abortion state, then we are dealing with the harassment from people that have that mindset. And so I'm not a medical staffer, I can't give all the information about abortion pill reversal, but I can say that honestly, depending on what state you're in, it's going to be a completely different discussion with the pregnancy centers and the medical community and the elected officials.
And I think that there might be some truth to the fact that these discussions look different based on political leanings. But I want to stick to, if you don't mind hanging with me 1 second. The actual practice that I'm talking about is recommending something that's like off-label for medication, and something that has been in peer-reviewed randomized controlled trials stopped as a practice because the repercussions were dangerous for the patients. So do you feel like presenting that as an option, just this one specific example, I'm not talking about all of the centers, just that one specific example.
Yeah, so I guess I will be very vulnerable here and share something that I was not planning on sharing at all, but I guess I will. I just feel like I should, because I think it will help me to answer your question honestly. I have endometriosis, and because of that, I've had miscarriage, and I just adopted a child, but I've not been able to birth because of my endometriosis. And I've been to a lot of doctors, and I think it ties into the pro-life, pro-choice thing, because every doctor I've been to, like, I was never diagnosed with endometriosis. They always told me to get on birth control. Go on birth control. Go on birth control. I'm sorry. Go on birth control. Go on birth control. Go on birth control. And it wasn't until I worked at ABC Women's Center and the sonographer said to me, Carrie, Christina, I think you need to get an ultrasound. And I said, there's nothing wrong with me because I've been to doctors my whole life. I just have excruciating pain in my periods. I've been hospitalized multiple times, but they've never said anything's wrong with me. They just told me to get on birth control, and I took birth control when I was 15. It didn't help. And the sonographer at ABC Women's Center, Carrie, said, I think you need an ultrasound, Christina. And she was the first person to ever say that to me. And I did get an ultrasound because of Carrie, the former sonographer at ABC. And then I was able to diagnose that I had endometriosis. And the only reason I say that is because of the abortion pill reversal. I know that's probably not the best word for it. It is progesterone after taking the first pill. And I have, this is outside of ABC Women's Center. I know doctors, Dr. Poppy Daniels. I went to see her for my fertility. There are children that are alive today that she gave progesterone to after the mother took the first pill, the RU486 pill. They took the first pill, then they went to Dr. Poppy Daniels, who I've been to myself, and she gave them progesterone, and their babies are alive today. So I'm sorry, but we're talking studies, and we also have experience. And just like you could put on trial naturopaths, and you could put naturopaths on trial and say the FDA has not approved activated charcoal. And you can make a whole case about and there's so many things that different people debate over when it comes to treatments and medical care. And that's probably why no one ever said to me, do natural things. The doctor would have never said to me, do natural things for, in fact, to bring it back to my endometriosis example, after some of it was taken out, I asked the surgeon, I said, would my diet affect this? Because I know naturopaths have said, if you eat cheese or different things, and he said, no. He said to me, no, there's no data on that. There's no data that your diet is going to affect endometriosis. And he's a licensed doctor, a surgeon in Connecticut. But there are others who say that there are. So again, you're getting in the weeds. But what you're doing, I'm sorry, God bless you, but what you're doing and picking on this one thing for ABC and ignoring all the thousands and thousands of women who've been helped by these centers, it's really wrong, because this bill is not about the abortion pill reversal. Because if you want to make it about that, then make it about that. Then make a bill that states no pregnancy center in Connecticut should be able to give out information on the abortion pill reversal. But that would be clear. That would be very, very clear, but you're not making it clear. You're saying it's deceptive, and we're talking about white lab coats, and we're talking about pictures on billboards. So I am emotional and passionate, but what I'm saying is, if abortion pill reversal is all you have, then pass a law about that and let pregnancy centers go on and do the rest of the amazing work they do in a pandemic to help women. I just don't want to harp on this one thing and ignore the test.
Miss Bennett, I just want Representative Foster to be able to speak as well. Thank you.
I don't know if we got to the heart of my question, but I think that we sort of get at. I don't want you to feel like you're under attack in this question. It really is.
I don't.
So my final point that I'm going to say is, I think if you have an example of something that is, I think maybe perhaps medically reckless. I think we need to be careful about how someone might think that a place that offers medical advice, guidance, or even pseudo-medical advice or guidance might be taking something to be safer than it actually is, because it's being associated with that care. And I am very sensitive to what you're talking about nutrition not often being recommended and advertised in the healthcare center. My doctorate is in nutritional sciences. I believe that there's a lot of food and nutrition work that we can be doing that would advance health and well-being. And I don't believe that's in the general scope of an ND typically. And I think that most of them don't want to do that work because they have other things to focus on. But I actually think scope is, interestingly, a little bit of what this is about. Is I think that sometimes people think that the scope goes beyond what it is because of what's shared. So I think you're missing part of that, and I'm so sorry that I brought up upsetting.
No. I mean, you're fine. That's fine. I didn't expect that was going to go in that direction. So, and I'm not usually a crier, but it's totally fine. It's on record now, so I guess the world will think that I am a crier, but it's totally fine. But I want to make one more point, and I'll be brief, and I'll also.
Well, would it be okay if we went on to the other, because there's some other questions?
Actually, no, it relates to your question. I don't think anyone else has brought this up the entire day, so I think it is valid. So because abortion is legal, and it's allowed. You have medical societies, people that have opinions that they have to be careful with what they say about abortion because abortion is legal. So going back to the two camps, for example, so pro-choice advocates, Planned Parenthood, for example, medical doctors, they might say something like the most common emotion that a woman is going to feel after an abortion is relief. Okay, that might be an example of something they would say based on their studies, their research with women, what they believe about abortion. Then you might have pro-life people, doctors, lawyers, who've done studies and everything else, and they might say, well, we've encountered women who felt regret. We've encountered women who felt shame. So then perhaps the pro-lifers would say, we believe that could be something like PTSD, or they might label it something like post-abortion stress syndrome. And then again, you've got the pro-choice doctors they can data, they've got different doctors, they've got different lawyers, and honestly, they're in charge. I mean, they're more powerful because abortion is legal. And so they have the medical science community on their side. And so, progesterone, taking progesterone after the first pill, an RE486 pill, yes, right now, what you're saying is true. Like that is, the medical community would say that that's not valid. But we're still not dealing with fairness, though, when we're discussing these things, because pro-life doctors, their voices, their experiences are being dismissed. So if I brought in 5 pro-life doctors who to debate this, you would still say, well, the FDA or these organizations. So we're never going to have a fair trial because they're not empowered.